when I tell you, I looked around, I was like, who is interested in going into psychiatry? Like, what? What's good, everyone? It's me, Dr. Ev, and I'm back with another video. Let's do a chit chat, get ready with me while I do my makeup, and let's talk. Let's get to know each other. You know, y'all don't know me, I don't know y'all, but I want to, so let's talk. I am going to be doing my makeup, and let's talk about why I decided to choose a career in psychiatry, because that's something that I get asked about a lot, and it's a very interesting, you know, like a very interesting course in the way I started or I got into psychiatry. So yeah, we'll do my makeup and we'll talk about it. Anytime I do my makeup, y'all, really anything, anytime I do my makeup, anytime I go to work, if I know I'm gonna work a long shift, I'm telling y'all, this literally is the truth. I love Alani. This flavor, the Hawaiian, can y'all see it? There we go. The Hawaiian shaved ice. It reminds me of Hawaiian punch, which I actually did not like when I was a child. But this is like the elevated, like what I wish Hawaiian punch would have been giving when we were growing up. It tastes so good. So I always like, that's like a thing for me, like doing my makeup. I have a Alani Hawaiian shaved ice. So just gonna pop this bad boy open. Yep, it's good. And it's gonna keep you awake. And I feel like it keeps me awake, but it doesn't necessarily give me like the shakes and stuff. So I really like it because of that too. And I'm actually very excited because this is the first time I'm doing my makeup at like my desk slash vanity slash content creator area. Like I usually will do my makeup in the bathroom and stand. So now I feel so like, I feel so grown. Like, okay, look at me sitting at my vanity with my mirror, doing my makeup. It's just great. So I tend to start with my brows first. So I'm just using like this little brush thing here. I wonder how it's gonna look, because if I'm looking over here, it's because I'm looking at my mirror. I don't want to be like looking at the binder. But yeah, I'm just gonna like smooth out, brush out my brows. My brows are pretty thin and they are definitely giving sisters and not twins. So I feel like I'm always fighting for my life, trying to make them look even, I'm not gonna lie, but let's try our best. Okay, I'm gonna use the Refy brush, or not brush, the Refy pencil, like thin brow pencil. Sorry, y'all, I'm not gonna be able to talk and do this. In fact, why don't I do my brows and lashes off camera? Because I usually do those things first, and then I'll come back and then we'll actually get started. Okay, y'all, I'm back. Whew. I was fighting for my life trying to put on these lashes and do these eyebrows, but they're done. Okay, so let's begin. Oh, have y'all listened to Normani's album Dopamine? Like, sorry, hopefully my best friend is the one that actually told me to listen to it, and this song has been on repeat since. Like, it didn't make enough noise for me. Like, y'all didn't talk about it enough. I'm using the Fenty primer to prime my face. So y'all, so anyway, so why I chose to go into psychiatry. So just a little bit about my background. So I always knew that I wanted to be a physician, like from a younger age. That was I mean, first of all, I'm Nigerian, so you only have a few options of what you can do anyway. It's either doctor, lawyer. Well, in my household, my parents were also anti-lawyer or anti-law for some reason. So it was really doctor, engineer, pharmacist. They were okay at pharmacy. So anyways, there's that. But thankfully, even with that, I felt like, oh yeah, no, I think being a doctor is probably the best route for me. Because very early on, I enjoyed working with kids. Like, I worked with my youngest sister a lot. Just was fascinated with that aspect of things. So I was like, yeah, being a doctor is fine. Being a pediatrician specifically was what I thought I was gonna do since I was like 9, 8 years old. And everything I did prior to starting med school was sort of geared towards that trajectory. Like, I'm going to be a pediatrician. So I went to college. I majored in initially biology like everybody else does. That was a no for me. And then I switched my major to child development because, of course, like I knew I was going to be a pediatrician. But then I ended up switching to public health and then started med school. Yummy Skin Glow Serum by Danessa Myricks. This stuff is really nice. It gives you just like a nice glow. So anyways, in med school during your 3rd year, that's when you start your clinical rotation. So basically you get a sneak peek, basically. Well, I don't even know if I would consider it a sneak peek, but you basically rotate through all of the major specialties in medicine. Major ones you rotate through, at least in my med school, was internal medicine, surgery, pediatrics, psychiatry, neurology, and emergency medicine. I believe those were like our main 6 specialties that we rotated through. So anyway, so again, I did med school. I knew I was gonna be a pediatrician up until 3rd year, and I started my psych rotation. Foundation, I'm going to be using the Lancome. There we go. Lancome in the color 540 Suede. You know, I'm so bummed they don't make this foundation anymore, or they make it, but they switched up the way the color works. And now I'm scared to like, because this is really like, well, to me, a perfect shade for me, and I'm scared I'm not going to find it. Anyways, that's besides the point. Usually in med school, and it doesn't necessarily have to be the case, but usually if you already kind of know what specialty you want to do, you tend to try to do that rotation later on in the year because you need to get letters of recommendation for when you start applying to residency. And usually by the second half or later in the year, you're better at it. Like, you're better at doing rotations. You kind of get the drill. You know how to speak to patients. You know how to write notes. You know kind of how to operate more as a resident. So people tend to do their interested specialty later in the year. So same with me. I knew I was going to do peds. I made sure to try to make my pediatrics rotation towards the end of my 3rd year. So that way I could be really strong and get really good letters from many of the attendings I worked with on peds. The way my schedule was set up, I was doing, dang, I say a lot. I'm so sorry. I'm gonna work on that. But the way that my schedule was set up, I was doing psychiatry first, then pediatrics, then neurology and emergency medicine or something like that. Yeah, something of this sort. Anyways, I'll never forget my first day of psychiatry. We were sitting in our lecture hall and we were being welcomed by the psychiatry clerkship director. And I will never forget, she asked us, who in here is interested in going into psychiatry? And when I tell you, I looked around, I was like, who is interested in going into psychiatry? Like, what? Who would do that? It's so funny how psychiatry is such a major specialty in medicine. And I can be totally and completely honest when I tell you I had never really heard of that as a thing before med school. It sounds insane. Well, it sounds so insane. Like, I knew psychiatry, but as far as like what they did, who they spoke to, I didn't even really know about people that suffered with mental illness. Like, to be honest, like I had no idea. And again, like I grew up in a Nigerian household where discussions were revolving around mental health, feelings, emotions. Like we didn't do that in my household. Like the toughest things that would happen to me growing up, if I was sad about it, the advice I would be given is like, not necessarily get over it, but dismissing of it. Like, you're okay. Like, you're okay, pray, everything's fine. Like, my mom or my dad wouldn't really let us get into much detail about how we're feeling emotionally. So back to that first day, I'll never forget. I was like, I can't believe anybody would choose to go into psychiatry. Ugh, such internal stigma about it. Rotation is broke. It's a 6-week long rotation, and it's broke into 3-week parts. And so my first part, I was doing the consult service at our main university hospital. And so consult is basically where you are providing consultation to other medical teams. So a patient who may be admitted on the medicine floor, on the cardiac floor, on the OB-GYN floor, and they have like a primary medical concern. That's why they're admitted to that unit, but there is some psychiatric concerns as well. So the team will consult psychiatry to come and give recommendations on their patient that they're taking care of. You see why I love this Lancome foundation? I'm so scared that they're not ever gonna have my color. Okay, but yeah, that I think, what do y'all think? I feel like it blended pretty well. I'm gonna use this one first, and then to brighten it up, I'm gonna use this Huda Beauty concealer as well. I start my consult rotation. Again, I've never known anything about psychiatry. I don't know what they see, what they do, which is, obviously that's the point of third year. Like, it's for you to learn. So that's not really that big of a deal that I didn't know anything, but I just didn't know what to expect. And our first case was older African-American woman who was admitted for decompensation of heart failure. So they consulted us on her because she was saying how she felt really depressed, that she didn't know if it was worth living for herself, just like very clearly depressed. So we went to go and speak to her about that. And sorry, the big part is that she was very depressed, and because she was depressed, she wasn't really like adhering to treatment recommendations of her primary team of the cardiologist. So like they wanted her to take certain medications, she would refuse, she'd be sleeping. Go speak to her. Mind you, she doesn't have a psych history. And we went to go speak to her, and we did the evaluation. Turns out she's actually been suffering with depression for several years and never sought out treatment because she was afraid of what her family would think if she was, in therapy or taking medications for mental health concerns. So she never actually reached out for help, even though she'd been struggling for quite some time. And so I, as the med student, and that's the luxury of being a med student, you get to spend more time with patients. You get to sit back. Like my resident was busy and had a lot of patients. I was like, well, I'm going to take this patient. And so I sat and spoke with her, and I was just kind of, learning more about her, learning about her background and what she's been through, and seeing what was going on now. And it was just such a cool, and I should also mention too, that before, like I mentioned, I'm rambling a lot, but like I said, I did these specific set of rotations towards the end of the year. So in the beginning of the year, I'd already done internal medicine. I'd already done surgery as well. But I'm gonna say this is the first time I felt like I could really sit down and that I was hearing more about the patient's background, and that was such an important part of the treatment plan, was hearing about her history. While I let that dry down, I'm going to go ahead and do my contour. I use this brush from e.l.f. I think it's pretty good. And then I use the Fenty Fenty contour stick, which I love. And I could see immediately with me being there with her, she felt a lot more comfortable just because I was speaking to her, just because I was taking the time out to really get to know her and figure out what her concerns are, why she's feeling the way that she's been feeling, what had been going on. And I could tell like she had just never really been given the opportunity to really talk about those things. And it almost felt like there was a weight lifted when she did. We did recommend that she start an antidepressant, and then we also recommended that she speak with the chaplain that was on service, as well as our psychologist that was on the team, and also a plan for when she was discharged. We were gonna make sure that she was connected to some sort of mental health follow-up afterwards. And I have to say that with that intervention, she did well. Like, I mean, she started to, as far as like in the hospital, she started to take her medications. She started to just become more engaged, more talkative, and just in general was doing way, way better. It dawned on me right then and there, the sort of interplay between mental health and medical physical health, right? Because this lady was in congestive heart failure. She is admitted in the hospital, has the treatment on board, everything is there to try to help get her back to optimal physical health, right? But what was the barrier? The barrier was her mental health. And I was just kind of blown, because regardless of what treatments you can give someone when they're for their physical health or when they're in medical health, if the mental health is not there, if the mental health is not optimal, it doesn't matter. Does that make sense? Like, I hope I'm making sense. I never recognized how important mental health is, how integral it is to every other aspect, because even if you have everything available to you, you have the medicines, you have the food, the whatever, like even if you are well resourced with everything else, mentally, if you are not at a place that's optimal for you, or if you're not at a mentally stable place, it's almost like everything else doesn't matter. You know, and that was like a clear example for that. I'm gonna do some liquid blush. I'm using the Rare Beauty liquid blush. Can y'all see that? Yeah. My other half of my psychiatry rotation was an inpatient unit. And again, my experience with mental health or with any people who had mental health was very limited, or people who had mental health concerns or issues or problems or ailments was very limited, at least to my knowledge. You know, like maybe because there's so much stigma and where I grew up, even like where in my household and even in my community, like that was just something that was never talked about, though I'm sure now, knowing what I know, that there's probably many people around me that did suffer with some sort of mental health ailment, but we just didn't talk about it. Being on that inpatient unit and seeing how people would come in when they were admitted to us and starting them on treatment, a very comprehensive treatment plan that involved so many moving parts and involved different people. This is the psychiatrist, and then also therapists, social workers, caseworkers. I mean, it was like, this is amazing. Like, we are really doing good work. And there's nothing, I'm not gonna lie to you. I'm not gonna lie to you. There is nothing like seeing somebody come in who is clearly in a very acute mental health crisis, and then seeing them on discharge and really like thinking like, wow, we did that. Because they're talking, they're engaging, they're with it, they're, you know, like their affect is different. It's just, there's no feeling like that. And I just remember coming home and talk about what I saw on the unit, and I was always just so happy about having seen these patients, and I would have stories, and I had just not experienced that feeling on any other rotation that I had done thus far. I was shocked. I was so shocked that I had such a positive experience. And by the end of the rotation, I was like, wow, I really enjoyed psychiatry. And the other thing too that made me even more happy was that I was working with a population that's so vulnerable. You get to kind of be the advocate for them. in a situation where there's probably not many people who are advocating for them, you know, because of what mental health ailments come with, because of the stigma, because of the barriers to actually accessing treatment. So it just felt good. I just felt really good. And there's something about working with a population who is historically neglected that it was empowering and at the same time humbling for me. As much as I enjoyed my psychiatry rotation, like I said, that was by far my favorite rotation so far. I was like, but girl, I'm a pediatrician. I'm doing peds. Like, it's fun. That was so great. Pleasant surprise. Loved it. Thanks. And I'm still doing pediatrics. Anyway, so the inpatient experience was great. I enjoyed it. It was wonderful. The best part to me was working with the kids, which didn't surprise me because I knew I liked working with kids. But I have to say that the excitement that I felt in psychiatry, I just felt like I didn't get as much of that in pediatrics. And like I said, I enjoyed it. It was great. I did well, you know, in the rotation, and it was good. And I think had I not done psychiatry before, I probably would have been like, yeah, this feels great. This is what I expected, you know? But because I did psychiatry before, I was like, but I didn't feel the same, you know? It's just so weird. And it's weird when you are on a trajectory and you had an idea for where you saw yourself going and something comes in the way that makes you kind of second guess what your plan was. To be honest with you, I was trying to fight it because I'm like, no way am I supposed to be going to psychiatry. That was not part of my life plan. That's where mentorship comes in. And so I reached out to our clerkship director. You know, I just started like reaching out. I was just like, I gotta reach out. I gotta start talking to people because I am very confused. I was not expecting this. And just getting to know this is important too. I was in SNMA. If y'all know that, a Student National Medical Association is pretty much like the biggest medical association, minority, specifically African American. So I was a part of SNMA all my time in med school, and I believe at that time I was also the vice president of our chapter. And our faculty mentor was actually a child psychiatrist, Dr. Bailey. Hi. I also reached out to her. I was reaching out to everybody because I was like, this is a life crisis. What am I gonna do? The more and more I spoke to people, the more and more I felt like, you know, I think my personality and the things that I value and care about aligns with psychiatry. And to be honest, it can align with both. I mean, I think psychiatrists take care of very vulnerable people. Pediatricians obviously take care of very vulnerable people because they're taking care of kids. You can't, you know, get more vulnerable than that. It reminded me of internal medicine, but for young people. It was basically medicine for young people. But I felt like when I was doing psychiatry, it wasn't as routine because I didn't know what I was gonna get. You know, I didn't know what was gonna come in the door, and everything's not the same. Like, two people can have depression and there's gonna be two completely different ways you're gonna address the depression, if that makes sense. Like, it's just, you can't throw the same thing you would throw at one thing at the other. So it was just, anyways, I feel like I'm rambling, but I will say the one thing about the pediatrics rotation that got confirmed to me was the kid part. I was like, yeah, but I still love the kids though. I still hadn't decided what I was gonna go into. And now it's 4th year, right? So now we're gearing up to submit applications for residency. So it's like, you need to figure out what you're gonna do. And we did a rotation with my SNMA faculty mentor, Dr. Bailey. I ended up doing a child psychiatry outpatient rotation. And it was such a great experience. I was like, oh, yeah, this is it. But me directly interacting with anyone, with any child, no, I can't say I had that experience. So to see that for the first time, and then, but more than that, to see how much better life was for the child when they were given appropriate treatment for whatever it is, whether it was ADHD, whether it was anxiety, whether it was like behavioral issues secondary to autism, whatever it was, to see children get better with the right intervention, and for me to still be doing the same thing, right? So me still taking into account all of their background, all of the other information that's super important, their social history, their developmental history, their this, their that, and that was all still very relevant in the treatment, and then to give the treatment and to see them get better. Sold. I was like, I'm sold. Like my journey into making the decision, but I'm gonna just also say a few other things too about what helped me really solidify the decision. And speaking to specific things about psychiatry, right? Ooh, girl, you say so much, but I'm new to this. Don't worry. It's gonna be a time where I'm not saying like this.